These are your kidneys, and located on top of your kidneys are these fat pads known as your adrenal glands. Now, you may be wondering, why on earth have I put an image of an avocado? Well, that's because an avocado and the adrenal gland have some similarities. Number one, both of them are actually made of fat. And the organization of the adrenal gland is just like that of an avocado. It has a central pit and layers of flesh around it. For the adrenal gland, the central pit, the central layer, is called the medulla. This produces catecholamines. You may be wondering and saying to yourself, I've never heard of a catecholamine in my life. Perhaps if I give you a different name, such as adrenaline. Adrenaline is an example of a catecholamine, also known as epinephrine. So this medulla produces the catecholamines, those fight or flight hormones, epinephrine and norepinephrine. So that's the central portion, the medulla. Let's go to the next layer. So we're going from the most inner to the outer. The next layer is here, the zona reticularis, which produces the gonadocorticoids, which are your sex hormones. So now let's go a little bit more outside. This is the zona fasciculata. It produces glucocorticoids. A very famous glucocorticoid you probably already know is cortisol. And right outside, the outmost layer, is the zona glomerulosa, which produces your mineralocorticoids. And we'll talk about all of these in just a moment. Just to review, the middle part is called the medulla. It produces hormones related to fight and flight, like adrenaline. And the rest of these layers is called the cortex. And the cortex has three parts. So we're going to go from the inside to the outside. Reticularis, fasciculata, glomerulosa. And so we'll talk about all these hormones in just a moment. Now, the story actually begins at the brain. The brain is the control center for the entire body, not just in terms of messages and controlling through our neurons, but also through hormones. This location of the brain is called the pituitary gland. Now, more specifically, the anterior portion, meaning the front portion, produces ACTH. Basically, you can remember it's a command for the adrenal gland. So the ACTH is released from the anterior pituitary, which is coming from your brain, and it travels through the blood until it reaches our good friend, the adrenal gland. Now the adrenal gland receives these messages, and now it starts to produce cortisol, right? We mentioned this is one of our glucocorticoids. Cortisol is important in regulating our blood sugar and as well as immunomodulation, a very important topic because that's when we later on we look at something called adrenal insufficiency. Our system is no longer working. We know that our pathways of sugar and immune systems are affected. We know also from the adrenal gland, we're producing aldosterone, which regulates our salt. And now we know wherever there's salt, there's water. And whenever we have salt and water together, it increases the actual blood volume and it increases the blood pressure. So this is not always a bad thing. You need to have some blood pressure. And we also mentioned we have the androgens being produced from the adrenal gland as well. Now, what if this process stops working? We term this as adrenal insufficiency. Our adrenal gland is supposed to do a lot of things. Produce the androgens, producing our sex hormones, producing our hormones like cortisol to maintain our blood sugar and regulate our immune system. And we have hormones that are there to maintain our salt and our blood pressure. So if these are not working, we term this as adrenal insufficiency. Now, there's two types of adrenal insufficiency. We could be looking at primary adrenal insufficiency and secondary adrenal insufficiency. Now, I know there's a picture of kidneys here, but we know that why do we have kidneys here? Because on top of your kidneys is your adrenal gland. Now, if we're talking about primary, the gland itself is not working for whatever reason. Maybe there is some sort of bacterial infection. For example, Neisseria meningitidis can actually affect the adrenal glands and cause them to be damaged. Perhaps a virus, or perhaps there's trauma, whatever it may be. If the adrenal insufficiency is caused because of a damage to the gland itself, we term this as primary adrenal insufficiency. We mentioned in the previous section that the communication is between the brain and the adrenal gland. What if the brain itself, and more specifically the anterior pituitary gland, is not communicating and producing the hormone we need to send to our adrenal gland? So we call this secondary insufficiency. Primary, the gland is affected. Secondary, something in the brain is affected. So what are some of the signs of adrenal insufficiency? Number one, we could be seeing a bronzing and pigmentation of the skin. And this can actually be a increase of a secondary hormone being produced by the brain called MSH. We know that because of our androgen, which is our sex hormones, we can see that there may be distributions and changes in distribution of our body hair. There could be GI disturbances, weakness all over our body, because remember, our adrenal gland is also maintaining our blood pressure as well as our sugar levels. We could be having weight loss. We could have postural hypotension. Hypotension is just a big fancy word of saying low blood pressure. And this is, remember, the adrenal gland also maintains blood pressure by regulating our salt. And we could also have hypoglycemia, which means low blood sugar. Like we mentioned before, cortisol also affects our blood sugar. So these are the signs that we could be having adrenal insufficiency if we have any of these things occurring to our bodies. Now, don't worry, there is treatment for adrenal insufficiency. We mentioned there are hormones, right? Like your glucocorticoids, your mineralocorticoids, your androgens, which are your sex hormones. So anything you have a deficiency of, you could be taking hormone replacement therapy. And we could also be making lifestyle adjustments. So we'll talk about all of these things in just a moment. Now, in terms of our glucocorticoid, remember, just like in our bodies we have cortisol, we can also have different glucocorticoids being replaced. So some of the most common medications are hydrocortisone, right here. We could also be having prednisone and also dexamethasone. Now remember, our bodies have a pulsatile, meaning it's coming in different bursts at different times of the day, releasing cortisol. So our glucocorticoids, right, in our bodies it's cortisol, but medications we could be taking are hydrocortisone, prednisone, dexamethasone. And depending on their strength and potency, you take a different dose at a different time. So we know that, for instance, in the whole day, we take around 20 milligrams of hydrocortisone in the whole day. And then that would be equivalent to, for example, 5 milligrams of prednisone for the whole day. And we could have 0.5 milligrams of dexamethasone. That's because that's much longer acting. Now, the interesting thing is that why I'm emphasizing that we're taking 20 milligrams in the whole day is because we need to mimic how does our body normally release this hormone. So in the cases of glucocorticoids, our body is releasing at different times. Remember, glucocorticoids affect our immune system and our sugar. So if we want to maintain blood sugars at different times, depending on when we need more or we need less, so we have different amounts of glucocorticoids coming in the morning, the noon, and the evening time. So our dosing, so we may be taking 20 milligrams for the whole day, but we will dose it and we'll divide it maybe 3 times in the day. And we'll talk about the specific dosing as we progress through the presentation. Now, sometimes what can happen is that, yes, I know I have a deficiency in my adrenal gland and I'm not able to produce my hormones. But sometimes I can have life-threatening emergency where I don't have any cortisol at all, meaning very low blood sugar and very low immune system modulation. So this could be a very dangerous time for me, and this is known as adrenal crisis. So in the adrenal crisis, so this could be happening whenever our body is needing greater immunomodulation, such as gastroenteritis, infections, even just normal stress in our lives, or trauma. So we're going to have vomiting, belly pain, weakness, fever, confusion, and we could just be feeling dizzy and passing out. So this is all the signs and symptoms of an adrenal crisis. So let's actually talk about now, what can we expect and what should we do if we get into one of these crises or any stressful situation in our life where we probably need to change the amount of glucocorticoid we are taking. Now, the first thing we need to do is, before we even worry about medication, we need to focus on ourselves in terms of, if we want to be helped, we have to show others we need the help. And so it's a wonderful idea to have a medical ID. So we'll take note of this. What are some changes we could be making? We want to wear a bracelet or a necklace indicating adrenal insufficiency for the emergency identification. So like we mentioned before, vomiting, confusion, even passing out. So if we have a bystander or even a family member who doesn't perhaps know us that well, they can know what's going on if we have one of these bracelets. Now, like we mentioned, during the times of adrenal crisis, we know we have a very low amount of cortisol, and we talked about we have to have hormone replacement. So for essential, immediate hormone replacement, we could be having a hydrocortisone injection kit. And so in this injection kit, we will have a vial of hydrocortisone and we'll have our needle ready to go. And it's a very good idea to actually keep our friends and family and those around us informed on how to draw up the medication, how to give us the injection if we are going through these symptoms. Here we have a little bit of a diagram. So usually you'll have an ampulla, which is this glass vial of the hydrocortisone. You will break the glass vial, then you'll withdraw the medication. There's already a sponge inside of the needle, and so you'll take up the amount of medication, remove the cap of the needle, and just put it into a larger muscle group like your deltoid, which is your shoulder muscle there. So these are meant to go into the muscles. Now, just very similar to our, like we mentioned previously, the medical ID bracelet, we could also have a steroid card. Like we mentioned, you looked at the slide and you know you have to break the ampule, you have to break the glass vial, put in your needle and extract the medication. Someone may not know that. And because they don't know that, how can they have immediate training? And so one of the ways you can get immediate training is that in your medical steroid card, you will have what is the medication, how much you should be taking. And if they don't know what's going on, we're in the modern age. It's wonderful. You have a QR code that can be scanned and they could be receiving an immediate instructional video on how to administer the medication. Now, a very big thing is that yes, there is a time of crisis, and so now we know we can have a hydrocortisone emergency injection shot. But a very big thing is that if you are living with adrenal insufficiency, it is very important that if I'm traveling anywhere in the world, I may not have access to my normal primary health care or my even emergency systems. So it's very important that if I request and I need a medication, maybe I lost my medication bottle, but how can I get a new prescription? So it's a very important thing to have a letter from your endocrinologist or your general practitioner detailing whatever is your condition and what are other medications that you may need. And so whenever we are traveling or just in our general life, we need to ensure that we have an adequate supply of medication and understand how to adjust the dose. So we'll emphasize on that, how to adjust the doses during illness or stress. And this is what we can say the bulk of this presentation in terms of importance is that, yes, I have adrenal insufficiency. I have a rough understanding of what it is, but now I need to know that just like my body adjusts the amount of hormone, when I'm feeling sick and I need more hormone, how should I adjust that? So, if you have a very minor illness, remember, we're thinking in terms of we know cortisol affects the immune system. So, you have to ask yourself, when is my immune system into overdrive? When do I really need some help? Right? And so in a minor illness, just like a common cold, you probably do not need an increase in dosing because it's very minor. Now, if you have a fever, and other forms of minor infection, what we do is we double the usual daily dose for the duration of the fever. So for example, I was taking 20 milligrams of hydrocortisone per day and I divided it into maybe 10 and 10. What I would do is I would do 20 and 20. But here's the very important thing about dose adjustment, especially with any hormones. If I am increasing the dose, I cannot just go back to normal. So I will taper it off. So I was taking, for example, 20 and 20, and maybe later on I'll take 15 and 15, right? So we try to slowly taper our doses back to normal. So now, if we have a high fever and severe infection, so high fever, so normally we say a fever is 100.4 degrees Fahrenheit. And so if we are now at 101, 102, high fevers, so we will triple the usual daily dose of the fever, and then we will return back over 1 to 2 days. Now, very important to note that again, daily dose, if it was 20 milligrams, I don't take, for example, triple that, 60 milligrams at one go. Just like the body, I will space it out at the morning, the evening, and the afternoon times. So now, if we have minor surgical procedures, for example, a dental procedure, I'll take 10 extra milligrams of hydrocortisone, hypothetically, before 1 hour before the procedure, because I'm about to enter something stressful, so I need to start producing the hormone before. Now, unless I have an inflammatory, an infectious, or a fever-like state after, and there's no need to actually increase the dose. But if I'm feeling pain post-procedure, then I can take a little bit more. So again, for major, we also do the same thing. 10 milligrams of hydrocortisone prior to the procedure. Then we double the dose for 24 hours after the procedure. And as always, taper it back down. I know I'm going to be running a marathon or just going extreme at the gym. So I will take an additional 5 to 10 milligrams of hydrocortisone 30 to 60 minutes before activity. So something we can notice here in all of these is that when I'm sick, I don't know a flu is coming, a few hours before. So I take it during the procedure and I compensate. But if I know a stressful event is coming in my life, then I can be proactive and actually take those doses of the medication beforehand. Now, if we have gastroenteritis, now this is one of the bigger ones, because if we have a full inflammatory state, and because, as we mentioned before, gastroenteritis and trauma are the things that could jump us into adrenal crisis. So it is very important that we have our hydrocortisone injection nearby in either situation, and we have immediate access to medical help. That does conclude this presentation. We thank you so very much, and we hope you learned a lot about adrenal insufficiency. And these were all of the classes of June, and we thank you so much.